And I think it is definitely my privilege to be part of this session. This is a session I want to be in. And thanks for that very kind introduction, which was longer than the time allotted to me. So I'm actually going to go slightly different, I was so engrossed in listening to everybody talk about their fellowships and how they trained. So I am not going there. I'm just talking about the fellowship model at LVP. And the reason why I'm talking about this is because, of course, it's the topic given to me, but also because I had provided a lot of input into what would be a perfect fellowship. And unlike the other short-term fellowships, this is a long-term fellowship. It's like a full-time commitment. So obviously, many residency programs, except for a few, they have a lot of lacunae in training. So surgically, fellowships are heavy. As you said, OPD load is obviously just volumes. But in that, there is no minimal research. There is no minimal niceties or learning patient care in a better way. And we don't have any subspecialty exposure when we finish residency. So there's a lot still remaining. There's a lot to be desired, even at the end of 3 years. I think when I finished my fellowship, I thought I knew a lot. But when I finished my residency, I thought I knew a lot because it was in Mumbai, which was surgically heavy. But after I went to LVP, I realized I really knew nothing, how to deal with the patient and many, many, many other things. So what was the fellowship about? It's that we want all trainees to be fit for general ophthalmology practice to start with, because they come in very raw. They don't know anything. They don't know any examination techniques from some of the residency programs. So therefore, they have to be proficient in the routine general ophthalmology practices. That is as simple as taking the intraocular pressure or fundus indirect ophthalmoscopy, because many residency programs, at least earlier, and even now, you learn on your own from your seniors or something. You don't learn it from specialists. So here we have instruction courses, or we have sessions on how to do IOP, how to do gonioscopy. So that's what should be part of the module of residency, which is not there. And of course, every general ophthalmologist should be proficient in cataract surgery. So when we had the fellows coming to us, they've done 5 to 10 cataract surgeries in their residency. That's because of the program or maybe COVID, various other problems. And then a resident is not exposed to administrative activities. So you're going out raw to run your own practice, but you have no idea how to deal with the administrative hassles and things like that. And then after you learn on this, then you should go into a subspecialty. Here we're doing the other way around, barely know anything in residency and directly diving into subspecialty. So what is the 3-year fellowship module? In the first year, the very first month that they join in, we call it an induction training, where they're taken through all the processes, because ours is a very sort of a big institute, and we have electronic medical records, we have so many NABH related activities, and they need to know a lot of things. So that entire 1 month is gone in that, maybe even learning the local language a little bit. Then after that, the next 8 months, we rotate them for 4 weeks in each subspecialty. So cornea, retina, glaucoma, and so on, plastic pediatrics. And in that, we also divide it so that they get 3 days there, they get 2 days to learn cataract surgery. So somebody's holding their hand and teaching them. Of course, if they're already proficient, so less holding the hand, but giving them cases to operate. And then of that, only 1 day in the week for the first 8 months, they spend in the subspecialty, meaning I may have joined for cornea fellowship, but in my first 9 months, I might do just 1 day a week in that fellowship, because the rest of the time, I'm learning general ophthalmology. I have to be a general ophthalmologist. So that was in the first year. The second year, we have several rural centers or secondary centers. So this is the best opportunity for the fellows to get much, much better at cataract surgery. So there's always a handover. So the senior fellow is already 6 months there. There may be a faculty, a young doctor over there. And then the new fellow joins in. So under the shadow of the senior fellow, they start operating. They do many cases over there. Maybe they may do maybe around at least 1,000 plus cases, or maybe 2,000 cases in the end of the 1 year. So at the end of the first year, they're excellent and very competent cataract surgeon. They know how to manage general OPD. They get little administrative experience of running a small center, dealing with staff, and so on. And then it's back to the final year. And this is what most people probably join, because they want to leave as glaucoma specialists, leave as retina specialists, and they don't want to leave as comprehensive or general ophthalmology. That's not why they've come to an institute. So here they come back. Now they have all that in their kitty, they have all that experience now, they've rotated in all the other departments. And in the last 15 months is when they spend in the core specialty. So if they've come for cornea fellowship, they'll spend 4 to 5 days a week in that core specialty. Of course, the institute assigns various other duties, emergencies, and many other duties that they have to do as well. And so at the end of 3 years, which is a long period if you look at it, but the 3 years is trying to make up for what was not done in their residency. So that's a reason for 3 years. They might, so a cornea fellow typically would have done 1,000 to 2,000 cataract surgeries and would have done at least 150 grafts, if not more. And they would have had at least 2 publications because that's mandatory. And they do get to present at state or national level meetings, sometimes even at international meetings. So this is the scope of the current cornea fellowship. It's very well designed for somebody who's finished their residency. Listening to others, I realized that you can't deep dive into other things and then say, okay, now I'm going to take 3 years off and come back from my practice and be a fellow. For that person, we have the short-term fellowships as well. So that is good for three months. So this is a fellowship which is customized for a fresher, somebody who's finished a residency and then wants to become a specialist. That's all I had to share. Thank you very much. And thanks for waiting for me. And thanks to Ranjana and the organizers for inviting me.